Hello and welcome to another episode of Let's Talk Health. Today's session will be on heart failures, and to discuss this, we have with us our senior consultant, Dr. Sudheer Koganti, intervention cardiologist and heart failure specialist at Citizens Hospital, Sherlingapalli, Nalagantra, Hyderabad. Good evening, doctor.
Good evening.
So, before we start with our questionnaire, I would like to give our viewers, a glimpse on your expertise.
As you know, Viju, we've been associated with Citizens for the last 6 odd years. Been heading the services here and was instrumental in setting up various programs such as primary PCI program for heart attacks, cardiogenic shock, and also more recently heart failure. As you are aware, we've started our dedicated heart failure clinic every Wednesday, and also our transplant program, which is very close to be kicking off. We have already assessed a few patients, and we're in the process of listing them. So once listed, as and when there is a donor, we would be able to transplant them. So we've also, what I'm trying to say is also instrumental in setting up our heart failure and transplant program. Prior to coming to Citizens Hospital, I was in the UK for almost 13 to 14 years, gaining experience in some of the world-renowned centers in coronary intervention, heart failure, and also transplantation.
So let's start with the question, sir. So my first question would be, what is heart failure and what are the causes?
I think before we define what is heart failure and talk about the causes, I think we need to understand what is the importance of heart failure. As you know, cardiac diseases are increasing exponentially. Every year, almost 2 crore people are dying due to cardiac diseases. And with more increasing incidence in cardiac diseases, this is going to lead to higher number of cases of heart failure as well. So we should be geared up to deal with this increasing epidemic, should I say, of heart failure. So we should not take this condition lightly. And also, a lot of people actually do not understand the gravity of the condition. So we really need to spend time with them. And one consultation is not going to be enough to understand the ins and outs of heart failure. So we really need to spend a lot of time and put in a lot of effort to drive this point home, and also to counsel the patients who are affected with heart failure. So I think that's most important. And now let's talk about what is heart failure. Heart failure is a condition. A lot of people have this misconception that heart failure means the heart has stopped working. That's not the case. Heart failure means the heart is no longer able to meet the metabolic demands of the body. It's not able to supply enough blood, oxygen, and nutrients to the rest of the body. So that's heart failure.
My next question would be, sir, what are the main risk factors for developing heart failures?
All the risk factors which traditionally cause heart diseases can cause heart failure as well. So when we talk about risk factors for heart disease in terms of diabetes, blood pressure, they can cause heart failure as well. And also indirectly, substance abuse such as alcohol can cause heart failure. And also there are certain medicines which we use routinely in chemotherapy. They're called cardiotoxic chemotherapies, something called anthracyclines, Herceptin, which is used in breast cancer, and some other medicines. These can also cause heart failure. So there are various other causes such as viral infections leading to myocarditis and heart failure, and also simple problems. To us, it's simple, but not to the patient, such as thyroid abnormalities. All these can cause heart failure.
So the next question would be, sir, are there any warning signs or early symptoms of heart failure?
Yes. Most of the times there are clear warning signs. Patients tend to notice breathlessness, particularly on walking, exertion, either on the flats with weights or up the stairs or up the inclines. They tend to notice fluid building up in the ankles, inability to sleep, inability to eat. The appetite goes down in some advanced cases, and feeling dizzy. And these are the common kind of signs and symptoms which a heart failure patient would experience. but sometimes it can also present suddenly. So out of the blue, they become suddenly breathless, which could as well be the first presentation. And only when they come to the emergency department after doing various other investigations such as X-ray and 2D echocardiogram, we found out that they've got heart failure.
So my next question would be, sir, how is heart failure diagnosed?
Um, Usually you get an indication based on the history and then the signs and symptoms. And then you're just going to go ahead and confirm it by doing various tests. You could do simple blood tests, there's one particular blood test called NT-proBNP, which is excellent in finding out if somebody's got heart failure or not. And then you would do ECG, 2D echocardiogram. And then with these three, you're going to find out whether somebody's got heart failure or not. And then you're going to do other tests to confirm the cause. And that may include an angiogram, MRI of the heart, or CT of the heart, and then various other blood tests checking for vitamin deficiencies, thyroid, and other problems.
So the next question would be, sir, what are the treatment options available for the heart failure?
Yeah, I think before we talk about the treatment, I think prevention is the key word. So like we discussed earlier, people who've got high blood pressure and diabetes are at risk of developing heart failure. So we should really target at that level to prevent any heart failure. But once heart failure is diagnosed, current medical therapy is excellent. There are about 4 sets of drugs called guardian drugs, which we use in various doses and combinations to ensure the patient remains symptom-free. And along with that, they may need medicines to get rid of the excess water in the body called diuretics. So commonly we call it Lasix, Dietol kind of tablet. So they need treatment to decongest, get rid of the excess fluid, and then those 4 guardian drugs, which I said, to stabilize the situation.
So the next question would be, sir, can lifestyle changes such as diet and exercise help manage heart failures?
Yes, yeah, very much so. Again, 2 different areas. So if you target the diabetes and hypertension in somebody who hasn't developed heart failure yet, with strict lifestyle, control the sugars, control the blood pressure, then you're going to prevent them from progressing to or develop heart failure. Contrarily, in a patient who already developed heart failure, if you can keep them active by regular exercise and you can keep their weight down, that is going to take a lot of stress away from the heart. And heart would be, a poorly functioning heart would be better able to meet the metabolic demands if you are active. But bear in mind, I don't think you would be able to do undue strenuous exercises like vigorous gym, those kind of things. Vigorous sporting, contact sports may not be ideal. But simple exercises like good aerobic exercise, 30 to 45 minutes of brisk walking, jogging, tennis, badminton, swimming, those kind of things, depending upon how bad the heart failure is, I think are going to help the patient in the long run.
So the next question would be, sir, are there any surgical interventions or procedures for treating heart failures?
Yeah. So usually these are the treatments which are reserved for advanced heart failure. So when you talk about heart failure, there are 4 classes of heart failure, stage A, B, C, and D. A is the class or stage where somebody is at risk of developing heart failure but haven't got overt heart failure. Whereas D is the stage where they've got advanced heart failure. This is the kind of stage where they're going to need surgical or other interventional techniques. So for example, if the medical therapy fails, then you're going to think about putting in advanced pacemakers, things such as ICDs, biventricular pacemakers, or conduction system pacing to improve the synchronicity of the heart and the pumping function of the heart. If that fails, then the only thing that is left is either going for a assist device such as a left ventricular assist device or LVAD or heart transplantation.
So the next question would be, sir, can heart failure be reversed or cured?
There are some sets of conditions or situations where heart failure, I wouldn't say can be reversed, but can be stabilized to a great extent. For example, in somebody who's had alcohol, if that person can abstain from alcohol, there's a possibility that we can achieve the stability. Likewise, the chemotherapy drugs, if we can stay away from further exposure, if we can put the patients away from further exposure of the chemotherapy drugs and give them good medical therapy, there's a possibility we can stabilize the situation. But reversing is probably not possible, because even in those subsets of population, if they go back and drink alcohol, or if they go back and get exposed to chemotherapy drugs, or stop the medical therapy which we've started, there is every possibility that the situation can deteriorate backwards.
So the next question is, are there any specific dietary restrictions or recommendations for people with heart failure?
I think generally eating a good diet is going to help them in the long run. A healthy diet, so that they can avoid unnecessary infections. But the two most common things which we recommend to every heart failure patient is to cut down the salt intake, and also to restrict the fluid intake.
So my next question would be, sir, how does heart failure impact daily activities and quality of life?
Well, you think about what is heart failure, and then you will be able to know how it's going to impact your day-to-day life. It's In heart failure, the heart is unable to meet the metabolic demands. So if you are an active person, once heart failure kicks in, you're unable to remain as active as you were previously. You may struggle to meet your daily work demands. You may slow down unduly, and sleep can get affected, leading to decrease in the concentration at the workplace, and so on.
So my next question would be, sir, can heart failure be prevented, especially in individuals with risk factors?
Yeah, same thing. When we talk about heart failure, we talked about those 4 stages, right? If you can identify the patient who is at risk of developing heart failure, that stage A patient, and target them, and treat them aggressively in terms of them and their risk factors, there's every chance you can prevent someone from developing heart failure.
So the last question for the day is, sir, are there any specific warning signs or symptoms that require immediate medical attention?
The one thing they need to watch out for is any sudden increase in breathlessness. Means probably there is sudden increase in the fluid content in the lungs, and that is the kind of situation where the patient is going to struggle. If any such situation arises, or if the attendant finds the patient to be struggling to breathe, or become the lips and the fingers are becoming blue, that means they're not getting enough oxygen because of the fluid in the lungs. Or any situation where the patient, not so acutely but chronically, is struggling to eat, drink, and sleep, I think those are the situations when they should immediately seek medical attention. Though we follow up regularly, in between the follow-ups, there's a possibility things may deteriorate rapidly, and in that situation, they should come for earlier medical attention.
Thank you, doctor. Thank you for your valuable time and valuable inputs. So with this, we conclude today's episode of Let's Talk Health. We'll be back with another episode next week. Till then, take care and be safe.